morning, everyone. And on behalf of Shelter Support and Housing Administration, I want to thank you for this invitation to come before you and speak today about how our shelter system in Toronto helps people with accessibility issues. And it's an important part of the work that we do here in the city with how we work with people who are homeless. And hopefully today's presentation will give you a bit of an idea of how we do that. I'm just going to give you a brief overview of our division and what we do, our Housing Stability Service Plan, some of the challenges that we experience and the opportunities that we're looking forward coming up in the very near future. So, Shelter Support and Housing Administration Division, we have a mandate, and that's to contribute to healthy communities in our city by providing a range of housing and shelter options for people in Toronto. Our overall goal is to improve housing stability and to improve housing options for people who are vulnerable, especially those who experience homelessness. We are the service manager for the city for the delivery of housing and homeless programs. And the funding of our division is divided up between emergency homeless service programs as well as housing. Just a quick overview of some of the numbers that we have. Our division has over 700 FTEs, and that's divided up between directly operated services, but also for the purpose of managing contract services as well. We see over 4,000 people every night in our shelter system, and we also fund 240 housing providers, and we administer about 150 grants to community agencies that provide drop-in services as well as housing help services. Our division also manages street outreach services. We both directly deliver it. We also contract with community agencies, and that's been in place since 2005. Just a quick snapshot of our the shelter system in Toronto. We have over 4,000 full-time beds, and that's divided up between both emergency and transitional beds. There's over 59 shelter sites across the city. They're divided up between 10 of them are directly operated by the City of Toronto directly, and 49 are contracted out through purchase of service agreements with community agencies. Our role in overseeing shelters in Toronto as well includes the oversight of the 59 shelter locations. We also oversee the assessment and referral process for people entering into the shelter system, and that's through the Assessment and Referral Center, where people can walk into 129 Peter Street location if they're seeking shelter services. They can also call a 24-hour central intake call center where referrals and an assessment would take place. And folks can call in also through 311 to do that. And that also oversees the Streets to Homes program, where services are provided directly to people who are living rough on the street. And as well as a service manager responsibility in overseeing shelters, we also have shelter standards, which are a set of expectations, guidelines, and requirements for the provision of shelter services in our city. A little bit about who uses our shelter services. As I mentioned, there are over 4,000 people who use shelter services every single night. About half of them are on the social housing waiting list because they need affordable housing. Half of the people that, many of the people that we work with in our shelter system identify significant challenges related to disabilities, substance use, mental health and physical health problems. And this has become a growing issue for us in working with people who are homeless, people living in poverty, and people who don't have access to affordable housing. It's compounded by the fact that people are on the waiting list and they're looking for places to move out to. Our division is Shelter Support and Housing Administration. We have a Housing Stability Service Plan that was approved by Council in 2013, and in it lays out 9 strategic directions that talks about the transformation of our shelter system in Toronto into one that's much more coordinated, integrated, and outcomes focused. And you'll notice that there are strategic directions such as improving access and equity and delivering high quality of service that kind of speaks to the fact that as a shelter system that we need to address needs within the people that we're working with that have significant barriers to services. The key actions around improving access and equity in the past few years have introduced some new service requirements for specific population needs that were identified throughout the development of the Housing Stability Service Plan, as well as the work that we knew that came through some of the consultations that we did to develop the service plan. And one of it was to provide 2 new LGBTQ2S youth transitional shelters. One just recently opened in February. We have one that will be opening up early in 2017. We've also opened up 2 24-hour women's drop-ins. They're up and running now, and that was really to address the specific needs of women who were homeless that need low barrier access to services. And just this year, we have 2 24-hour cold weather drop-ins that are now open throughout January and February. We received funding for that as well to speak to the growing need of shelter space during the winter and being able to have drop-in centers that are low barrier and accessible. This year we'll also be looking forward to opening up a new senior shelter because seniors is also a population that we are very concerned about because the growing needs of people who are aging on the street and living in shelters is an increasing problem and one that we want to be able to better address. Many of the seniors that we actually are working with are people that are aging, have significant issues around mobility and access. Many of them have wheelchairs, scooters, walkers, and other mobility devices that make it very difficult to manage when living in shelters. Last year, our division completed a shelter infrastructure plan, and it was approved by Council in March of 2015. The report talks about the status of the occupancy in our shelter system and some of the many challenges that we're dealing with here in our city. It also talks about areas of vulnerability and some of the actions required. The report also identifies a goal to have 20% of our beds designated as fully accessible. What we know is that we have shelters that are not fully accessible, but they need to be, and this is a priority for us. We do, however, have shelters that have various degrees of accessibility. For example, facilities may have an elevator, but not have accessible washrooms, or may not have bedroom door widths that are not wide enough for scooters. Because of the growing scooters are becoming an increasing way for people who have mobility issues, and some of our shelters are not able to provide that help. Our Toronto Shelter Standards is one of our key actions to develop them, and they were just completed and approved by Council in October 2015, and we're really proud of this piece of work. It took 2 years to complete. It was last upgraded 13 years ago, and it was time that we had an opportunity to make sure that they're more in line with municipal bylaws and other regulations such as AODA requirements, and so they're now ready for implementation. The accessibility was a key priority in developing the shelter standards for the shelter system, and looking at AOD requirements as a specific lens in terms of how we're delivering services to help better meet the needs of people who are homeless. We ran many consultation groups, which is why it took so long for us to do, but some of the clients engaged include focus groups with people with physical disabilities and for people who were seniors. The new standards related to accessibility also includes service animals, and I know that was talked about today, and it's an important one for us to identify that our shelters need to be more accessible for people with service animals. The shelter standards also talks about new mandatory training. It's currently being developed with our colleagues at the Equity, Diversity and Human Rights Office to better help shelter staff in working with people who have disabilities. The other parts of our shelter standards that might be of interest is that we also talk about access and request, that all persons have the right to seek shelter services, and that all shelters will provide information about their shelters and various ways to obtain services that are understandable, available through various means, and accessible to people with disabilities. And that shelters will work at eliminating real or perceived barriers that prevent or inhibit client access to shelter services in our city. As well, our intake and assessment process will take all reasonable measures to accommodate clients with a disability, and that shelter providers will take reasonable measures to accommodate clients accompanied by service animals or emotional support animals. Most of our shelters come into contact with people that have emotional support animals, and this is something that we needed to address and make sure that shelters were prepared to revise their policies and the procedures and able to accommodate that. Into December 2015, we managed to secure some funding to help shelters implement these standards. And with it, we put out a request for application for funding to assist shelters with implementation, specifically around those with AODA requirements. And we're happy to help those shelter providers, the community-based shelters, to be able to receive some extra money so that they could do some upgrades within their facilities. Some of the challenges and barriers within our shelter system is the fact that we have about 27 shelters out of the 59 who are barrier-free, and that we need to do better on that, meaning that 27 doesn't mean that they're all fully accessible by no means, but they have some access, some wheelchair access. Some of them have accessible washrooms, but may not have elevators, such as I talked about before. And this has become a real and growing challenge for people that are using wheelchairs and need to access their services. Some of the service improvements that have been identified in our shelters infrastructure staff report that was before council last year talked about the other challenges within the shelter system that we are going to have to face and deal with, and a lot of it has to do with healthcare policies and funding and how we take care of people with mental health and substance use when those supports are very few and not coordinated. As I mentioned, we have an aging population as well, and this is also compounding on an already challenging shelter system environment. The child welfare system, criminal justice system, victims of domestic violence, and lack of affordable housing are all of the combination of the themes and challenges that are before us. In addition, helping people who are experiencing barriers become even more complex. So last Friday I had to deal with a situation where we had a woman who was 60 who had been discharged from a long-term care facility and was incarcerated for starting a fire in the long-term care home that she was in. She was kept in jail for longer than she needed to because the judge was concerned about her safety being released to the street because she could go back to a long-term care facility. She was discharged to one of our shelters, and immediately the staff didn't have the expertise or the capacity to take care of her because she was incontinent, she had mental health issues, a whole range of chronic health problems as well. She ended up going back and forth from hospital to shelters to our drop-ins, where finally when she came to one of the hospitals that she was in, we had to step in and be able to tell the hospital that we weren't going to. The Toronto shelter system cannot take our drop-ins can't either. This is just an example of some of the challenges and barriers that also include an aging infrastructure within our shelters, whereby shelters have been around for a long time and it's going to take some funding in order to upgrade them. Some of the opportunities that are coming forward that we're really looking forward to is the development of 12 new shelter sites, and all of them will have to abide to our Toronto shelter standards, and all of them would have to be AOD compliant. We have new shelters that are opening, as I mentioned, the new senior shelter, the Salvation Army Hope Shelter. We received direction from Community Development and Recreation Committee to pursue the continuation of a shelter that is in Scarborough. We'll be putting plans in place to do that. Again, that will also have to be meeting the AOD requirements. We have a Hostels to Homes pilot project that will be seeking to address 200 people that are in our shelter system that have been in our shelter system for over a year, 2 years, 3 years. We're looking to have a look at what their needs are and to better understand why people are staying in the shelter system. But what we do know is that people have significant challenges around mental health, substance use, and physical disabilities, and we're looking forward to being able to figure out a bit more around the research on that and to better help address their needs. The other big opportunity that's coming forward that the city is working on right now is the George Street redevelopment revitalization project. We call it the GSR project, and that is a project that is providing an innovative approach to excellence in service delivery for vulnerable men and women in our city. And it's seeking to redefine how the city addresses the needs of people who are homeless with complex needs. The project involves the demolition of Seton House, and Seton House is a men's shelter located at 339 George Street. It was built in the 1950s. It's 100,000 square feet and it has 600 beds in it. And what we're doing is we're partnering with our colleagues on long-term care homes and services that also need to relocate some of their homes. and redeveloping a massive lands that includes some heritage property on George Street. And what it will be is a new complex, a new campus, if you will, that will have a combination of affordable housing, emergency shelter, a community hub, long-term care beds, and transitional assisted living beds. The site itself will be fully accessible. It will meet all AODA requirements, and it's something that I think our city will be proud of in terms of how we address people who might be living in poverty, who have complex issues, and who are very vulnerable. Some of our next steps is that shelter, support, and housing, we acknowledge that this is work to do, and we're committed to continuing our work in terms of addressing the needs of people who are living with disabilities and who need to have accessible services. We understand that everyone who's homeless has a right to access shelter services that meet their needs. And we are going to be identifying strategies in the very near future to increase the number of physically accessible shelter beds as it is outlined in our shelter infrastructure report. With that would come with an audit of all of our shelter systems. We'll be developing audit tools, training as well, to be able to assist shelters in identifying how they could better make their shelters accessible. The new Toronto shelter standards, like I said, will include training for staff. It would also include making sure that all of our new sites, as I mentioned, will be meet the AOD requirements. Thank you.
Thank you very much, Karen, for the presentation. And I'd like to know if there are any questions from our committee members. Stephanie's hand is gone up, so that's Stephanie first, please.
Thanks very much for your presentation. My question is regarding your definition of barrier-free, and does that include communication access for deaf and hard of hearing people? Things like when a person is attending intake and assessment, are the staff trained on providing clear communication, access to ASL interpreters, or to technology for hard of hearing people? Things like visual smoke alarms in the shelters and so on.
Yeah, those are all some of the priorities that I looked at in the Toronto shelter standards. And if they didn't already exist, and some of the shelters we're doing in them are currently addressing those needs as they come along on a case-by-case basis. What we wanted to do with the Toronto shelter standards is to have a better way, a better meaningful way to standardize what some of those things are. Say, for example, if someone was coming to an intake for a shelter bed and they didn't speak English and English wasn't their first language, well, the staff would look at use their resources in a way that would better help assist that person. Many people come to our shelters that are may have hearing issues, may be hearing impaired. And I know that our staff and my own experience of working with people is that you look for ways you need to do that, but that's sort of dependent on the actual workers. Our training that we're looking to develop, and it's not yet developed, would be a way to help staff know how to approach people who have a disability and making sure that we're being fully accessible. So we're looking forward to doing that.
Thank you very much. Can I get Rahima? Questions?
You mentioned Housing Connections waitlist. How many people are on that list?
I believe it's about 94,000, almost 100,000 people are on the wait list. Yes.
And affordable housing, 21 units. What do you consider affordable, and where are they located?
They will be located right on the George Street campus. I didn't bring the actual designs because it's a lot to kind of go through. And it's being built in connection with our affordable housing office at the city. And it will be meeting the standard, I guess, provincial requirements around affordability. There'll be rent geared to income is what I wanted to say.
Thanks.
Tracy to ask questions, followed by Tom.
Yes, in the range of services that's available, is attendant services for people with physical disabilities also available within shelters?
Are you referring to personal support care, personal support workers? Right, so our shelter staff do not provide that work. If people are coming into our shelters that need that level of care, it's coordinated through the Toronto Community Care Access Services, where assessments would be done by CCAC, they would be brought into the shelter. What we're finding is that there are a lot of people who actually need that care. I talked about the men at Seton House, and one of the things that we did with respect to our service planning on that project was do a needs assessment with CCAC. We found that 30% of the men who live at Seton House actually need to be in long-term care, but because of their barriers that they're living with, such as mental health, addictions, and behavioral issues, they're unable to access those services. So we recognize that this is a need, that there needs to be a greater level of service planning between health and housing and shelters. But just to answer your questions, if people do need that help, it's coordinated through CCAC.
Thank you, Tracy. Tom, to ask questions.
Thank you. Given the fact that people with disabilities, statistically speaking anyway, are the lowest income, live at the lowest income level, and are the highest in unemployment levels, it would stand to reason that the population that you're serving would probably be disproportionately represented by people with disabilities. So what are your statistics on people with disabilities, the number of services that you provide to them and who they are that actually need your services? Do you have any of that?
When we do our intake and gather information from the people that we work with that come into the shelter system, we don't actually look for specific information around their disabilities in order to track it. I guess is what you're looking is for the specific data. And some of it has to do with the sensitivities about being able to do that with the person that we're working with, and the assessment tool that we use to track it. So no, we don't have specific information. What we do know is, like I had mentioned before, is that we have a large portion of the people that we work with are struggling with mental health, with addictions, and other forms of disabilities as well, that, as you say, and we recognize, are having challenges entering into employment, accessing housing, and the affordability issue, but I don't have the data to speak to that.
Challenge from my perspective is if you don't have the data on the population that you're serving, it would be very difficult to create services that would actually assist them, or even when you're talking about accessibility, what does that mean to the population that you're serving? So without the data, you really don't have anything to base your go-forward plans. And my second question was, what are the go-forward plans to provide enhanced services? My wife works at a rehab center, and she told me that in the last month, at least 3 of the patients with spinal cord injuries were released to your system. What does that mean for a quadriplegic or a paraplegic to be released to your system? What kind of support would they get? Would they survive on it?
Absolutely. I hear your point, and that has been one of the growing challenges for us regarding the healthcare system and how they're relating to the shelter system. Too often people are being discharged from hospitals and from other care facilities into the shelter system simply because there's no other place for them to go. What we're trying to do is do some service planning with the Toronto Central lens, with CCAC, to have a more strategic plan around where people should be going in our city that need that level of care, because as far as we're concerned, that's inappropriate.
I think one great way to start would be for you to collect some stats on them, so you can then go with cold hard facts and ask for something.
Tom took my question, I have to say. What I wanted to ask is whether or not you've done a needs assessment related to the needs of people with disabilities and accessing the shelter system. In particular, I think what would be important is to consider referring agencies too. So you're talking about CCACs and the LINs. Has anything like that ever happened? Have you ever had a needs assessment focused specifically on persons with disabilities in your system?
Not specifically for the entire system. So what we're doing is with our Hostels to Homes pilot project is an opportunity for us to look at 200 people that are staying in the shelter system for a very long time. What we are piloting is a housing assessment tool that kind of focuses, instead of the specific needs of the people that are living in the shelter, because a lot of it has to do with whether or not that they would actually participate, whether or not they would declare the information. What we're trying to do is look at, if they were to leave the shelter system, what would their needs actually look like to better help them find the services they need outside of the shelter system. We also, as I mentioned with the George Street project, we did a pretty comprehensive needs assessment for the people that live at Seton House, and that gave us an idea of some of the information that we needed to gather in collaboration with CCAC, our other service partners such as the Inner City Family Health Team, and with the Inner City Health Associates. And that gave us a baseline of trying to figure out how to work with people who had significant challenges. And from that assessment, there was a great deal of information that came back that talked about people's disabilities.
So just a follow-up question. You had said, kind of follow-up, 27 out of 54 have some accessibility. And I'm wondering, how is that considered? So what does some accessibility mean? And if that is the case, if only some have some accessibility, how do people with disabilities make decisions about what shelters they might need to enact with?
So the 27 shelters that were identified that have some accessibility could mean that they're fully accessible. So it's a combination of having an elevator and having other things in their shelters that actually make them fully accessible. And some of them could have some barrier-free services as well. Like I mentioned, some of them may have accessible washrooms, but their door widths are not wide enough to be able to accommodate people in scooters or in walkers, or wheelchairs rather. But our shelter infrastructure report recognizes that, and so that we have some work to do. The challenge there is the funding required in order to upgrade some of our shelters and facilities to make sure that they're better able and equipped to help people who have disabilities. How people make decisions about where they go, what shelter they go to, and our central intake process, as well as the Streets to Homes Assessment and Referral Center, the staff at those locations understand where the suitable shelters would be and be able to give people with disabilities some options as to where they could go. But we could do better.
Another follow-up question? Or to speak? I'll say no. Okay, I'm going to acknowledge you shortly. Any other questions? Councillor Carroll.
I'm just wondering about things to do with inclusion can be addressed right now with the right partnerships, and I'm wondering what's happening in that regard. There are a number of people both in TCHC units and the shelter system who are people with autism, people with developmental disability, who aren't necessarily going to disclose that to you. Do you partner with the agencies and bring them to that client's needs, regardless of what they disclose? What's the training for staff?
Some of the shelters are better equipped to to coordinate services with various service partners than others. Part of our strategic directions that we identified is this very fact. And so the coordination with partner agencies and with partner systems is actually an important key in terms of the transformation of our shelter system so that it's better integrated and coordinated. So we've identified that working with corrections and working with the healthcare system and child welfare systems are going to be key in order for us to address these going forward. The service planning that has started the conversations with the LINs around how do we care for people who have complex issues and how do we coordinate it so that people aren't slipping through our social infrastructure. The gaps in our social infrastructure is an important one. And I think that the George Street project has been key in that in terms of understanding how that's going to happen going forward. Just with respect to the developmental disabilities, we are starting a pilot this year. We received some funding and we're partnering with a couple of agencies to be able to address the needs of people who are in the shelter system. They're identified as that group, and we're looking forward to doing some learning and some research. So part of it is us getting better at doing the research, because I heard that was the point, And we recognize that going forward, and so we're looking for ways to be able to target that and to work with the specific agencies and services to come in to be able to help address those barriers.
Right, so you're saying some of the centers are equipped to do that now. But if someone's presented himself at another shelter, one that you may not think is the perfect one for them, can you quickly access a social worker you think might have the right speciality? How do you deal with them in the immediate?
So each of our shelters do have caseworkers, case managers
Yeah.
that are knowledgeable about the resources that are available. So they're able to make referrals, they're able to identify another shelter that would be helpful, or be able to reach out to our assessment and referral center and say, I have this person, I need to find another bed, or we're experiencing some barriers. Our shelters are actually coordinated in that way, so that if one shelter is experiencing some significant pressures because of a person who is not getting the right types of services,
Right.
there's avenues for them to reach out and look for that system support to be able to link them up.
Okay, and that's available right now?
That's happening right now.
Okay, thank you.
Thank you very much. Are there any other questions? We can move the speakers then. To speak, Terry Lynn?
So I'm very excited about the different projects that are happening around the city around shelter support. I think it's a lot more work on shelter support than we've had in a long time. At the same time, again, I'm speaking to the converted, that ideally we don't want anyone to be in a shelter, right? So the question really lies at, like, how can we make housing more accessible? How can we make services more accessible so that we're preventing homelessness and people aren't going into shelters? And a couple of things that I wanted to speak to. I know this is like old information, but it was the best report I can find, and I remember when that report was created. So there was a report created by Sistering and the Wellesley Research Institute in 2006, again I said it was old. And they just did a survey of people that were coming into walk-ins, and they interviewed men and women, but there was a particular focus on women, and they estimated that 67% of the people that they interviewed had one or more disabilities that was restricted, right? So we're talking about things like arthritis, we're talking about people with mobility devices, certainly mental health issues, things like liver failure and heart disease, those kinds of things, but definitely disabilities existing in there. So we do have, based on other research that hasn't necessarily encompassed the entire system, that says we're disproportionately represented in terms of the homeless population in Toronto. I also wanted to speak to 129 Peter Street. I know in the VAW sector, so the Violence Against Women community, that location is not considered safe for lots of populations, people with disabilities and women in particular. So when you're working at a drop-in center, we always tell folks to go with a friend. So there needs to be some workaround there. But I'm sure you guys have heard about that before. And also, like, I think it's entirely unacceptable that people with disabilities in particular, who need particularly, why am I forgetting the word? Attendant services, are actually staying in hospitals longer. We know that's true because they don't have anywhere to go. So that's often an under-researched population, because when you're targeting people to access for homeless services, often that population gets discounted because they're not part of the catchment area. And certainly people should not be in jails for longer because they don't have housing to go to and a safe place to go to, right? And I get that you're alongside because you spoke to that as being unacceptable. One thing that I thought was really interesting was you said you have a harm reduction policy for substance abuse, which is common in city shelters, and I support that. But I would encourage you in policy, if we look at harm reduction from a perspective of reducing a policy or program that reduces harm, we certainly need to look at how we're reducing harm and increasing safety for service users with disabilities using the AODA Act and current tools that we have within our system to do that. And in addition to that, you need to look into things like, you mentioned mental health things, so things like reducing self-harm. We're already seeing LGBTQ shelters in the city of Toronto, which are very needed, and I'm very excited about those particular shelters. So just maybe like broadening the harm reduction policy to target certain populations that we know to be vulnerable in terms of housing and homelessness. And just wanted to also say that, you know, in terms of the CCAC assessments, for in-shelter supports and assessments, that's always going to be piecemeal. And I'm a fan of the CCAC for lots of things, so it's not that, but it's harder if you're attendants or CCAC workers to have that attendant actually show up on time, to be comfortable working in a shelter, to be comfortable working around other folks. And we know, people have already said this on this committee, we know that buildings and services that follow the AODA Act are not necessarily accessible to the entire population, and it's certainly a legislation that doesn't have a lot of teeth, right? So some of the shelters that are brand new, coming up and running right now, are not going to be accessible to tons of service users. My very last point is, I'm aware that people at Seton House, many of them have disabilities. However, and I'm very aware that you guys are working on it as well with the new location. But the accessibility of Seton House in particular was abhorrent. So you wouldn't have gotten a lot of service users with significant physical disabilities in that particular shelter.
Thank you very much, Terry Lynn. I think I see Wendy's hand followed by Karma. Wendy to speak, then Karma.
Thank you again for your presentation. And I know that you're doing really, really hard, great work. I think that we can acknowledge that the shelters here, that you're all working very, very hard on a very difficult problem. So I certainly appreciate that. One thing I wanted to say, you know, Tom has made this point too. We know that persons with disabilities are probably more prevalent in this population than in others. And I know that Dawn Canada has been doing some work around accessible shelters recently. I can find the report and make it available through whoever, but it's something that I would recommend that you have a look at, in particular around the needs of women with disabilities in accessing shelters. You know, there are higher rates of abuse for a number of reasons, including not having access to accessible supports. So it's a very important issue. Regarding the needs assessment, the reason why I asked, and I agree with Tom's point earlier, if you don't have the data, and you're certainly saying this too, if you don't have the data, it's very hard to know how you can make the services improved. So if you don't have a baseline, how do you improve things? And one of the things that you spoke to was around disclosure, that, you know, the issue of disclosure can make things difficult when you're trying to do these kinds of things, because somebody's in crisis, you don't want to also ask them if they have a disability or not, or, you know, adding to that kind of scenario. But what I would say is that a needs assessment could start actually with the referring agencies and with organizations that serve people with disabilities, asking them questions about the needs of their clients who may or may not have accessed the shelter system. One of the groups that I worry about, in fact, are people who can't get to the shelter system because of the complexity of trying to find a place that would actually suit their needs. So I would make a recommendation to you that, you know, if you think about a needs assessment in a slightly different way, in terms of talking to people who might know what happens to somebody with a disability who has tried to access and has not had success, would be a way of starting and certainly getting around the disclosure issues. And one other thing I wanted to ask about is or comment on, can the information about the accessibility of the facilities be made more publicly available in a kind of a centralized place? Because I know that you said that the central referring agency, the central referring office, they're aware of people, what needs that they have and the shelters that might match up. But certainly I can imagine people who are not going to go that route and who would like to go directly somewhere, maybe in crisis. So certainly the accessibility, information that you do have about the accessibility of the facilities being more publicly available could certainly help to address that concern.
Thank you very much, Wendy. And I would suggest that if you want to send along the link to the Dawn Canada report to Nicole or my office or the secretary, then we will make sure that all the members of the committee and as well as Karen have access to that information. And Karma to speak. followed by Tom.
Okay, well, I was just gonna echo what Wendy and Tom said. You guys are doing a very difficult job, and, you know, data is needed. One of the things I would also like to emphasize on is training. Just because I read a report, and they weren't talking about shelter workers, but they were talking more about psychiatrists and other mental health counselors, right? And they were just talking about how even amongst these individuals who should technically know better, right? And who are, you know, directly working with people with mental health issues such as schizophrenia, that they still have some sort of judgment, you know? They might use words that are technically not appropriate, right? And so I'm thinking that if you're talking about professionals and, you know, they're talking about like psychiatrists and all those people, that might also, you know, trickle down to you guys as well. So I'm thinking about maybe, you know, training should be a priority, and knowing that, you know, your clientele isn't necessarily going to be just type A persons or type B persons, but there's all sorts of different types of people coming in to you guys. And also maybe extend the training beyond just your area, but to the whole of the city workers, because sometimes even if I call 311 and I'm saying something, oh, accessibility, wheelchair accessibility, they go, what is this, what is this? And so I have to say, are there stairs? And then, you know, I have to go through all of this little procedure about, you know, what accessibility means, you know? And so that can be sometimes challenging. And the other thing also is I've heard of shelter homes where, you know, because I know one of the things that shelters sometimes insist on people doing is abstaining from drugs or alcohol, right? But I've heard of shelters where they have a tech, you know, targeted to one type of substance abuse, you know, individuals that, you know, maybe they're alcoholics or something, right? And so maybe that is one of the ways of reducing, of ensuring that, you know, these maybe difficult to handle cases are being treated properly. And also the other thing I would point you guys towards, I don't know if maybe you've heard of it already, but in Utah, they've reduced homelessness dramatically. And the way they did it was they gave people homes, period, right? And in the end, yes, you know, it costed them a lot more in the beginning, but in the end, it reduced costs dramatically, right? So that's all I suggest. Thank you.
I see Tom to speak and then Stephanie.
Thank you. My comment has to do with collecting statistics, again, to just reinforce my comment before, that how important it is for you to have the statistics. Even when you go into back to the council, to the city, asking for more money or expanding services, you should have statistics to back it up, otherwise your case is really weak. Your problem with getting that information from the individuals has already been faced by a number of groups. Employers are one, and I spent a lot of time working under the Employment Equity Act as an employer, and they certainly have to ask that question of all four groups, people with disabilities, Aboriginal people, visible minorities, and women. So that question is already formulated and has been being used. Other employers who are not compliant with the Employment Equity Act also are asking the same question. The City of Toronto, as a matter of fact, is asking that question. Outside of that Employment Equity Act, I'm sure Nicole would be able to help out with that. So there are different models of asking that without being intrusive or invasive, and still help you collect that information.
Thank you very much, Tom. Stephanie to speak.
Just getting back to the issue about having clear communication available to people using the services, I can't emphasize enough how important that is in terms of allowing people to understand what's happening with them. It also helps to reduce incidents of frustration and aggression. There are studies coming out about the links between lack of communication or being deaf or hard of hearing and dementia in seniors as well. And so clear communication in many formats really helps all around in the overall well-being. Often the issue of funding comes up. It's an ongoing situation. Many of the supportive housing facilities really expect referring agencies or partnering agencies to be the ones funding access, which is not always ideal. And even on a case-by-case basis, my experience is that when there are tenant meetings, even if there are deaf and hard of hearing people in the facilities, supportive housing facilities, access to communication is not provided. And then again, it's just a cycle where if they don't have access to information that helps them be independent in their living situation, it just, again, exacerbates their situation and it increases issues of frustration, mental health situations as well.
Are there any other speakers? No? So in the interest of time, I'm going to not speak, but I will ask the committee member to move to receive the item. I see Stephanie's hand. Thank you, Stephanie. Okay, thank you, Karen. Your job is difficult, but we know you're doing the best that we can. I recognize in the interest of time, we generally have a stop time for our committee